Thank you so much for joining us on this episode of Family Matters. My name is Purity Museu. Over 200,000 people have died of COVID-19 globally. This is according to a tally by Johns Hopkins University. The same tally has estimated that about 2.8 million people have been infected by COVID-19 around the world. In Africa, 28,000 people are positive for COVID-19. And Kenya is among the countries struggling to contain the spread of COVID-19. As a journalist who has been at the front line in the coverage of COVID-19 pandemic and probably interacting with healthcare providers who have had direct links with COVID-19 patients puts me at a risk of getting the virus. Today, I will be testing for the disease, and I will be going to a national testing center at Kenyatta National Hospital, where doctors there will take samples for testing. So join me as I take you step by step on what testing for COVID-19 really involves. So we are now at the National Influenza Center, a government institution that is now responsible for the COVID-19 response. This involves testing to make decisions on isolation and treatment of COVID-19 patients. And of course, this is where we are going to meet Dr. Mamo, who will be taking us through what it takes to test for COVID-19. And of course, he'll also be helping in taking my samples and testing but inside here on COVID-19. Welcome, Dr. Mamo, to this program.
Thank you, Purity and the team. You are most welcome to National Influenza Reference Lab or Center. This is the government facility that is responsible for diagnosis of COVID. And we work in relation to the testing with our other reference labs, like Kemri Labs, Kenyatta Labs, MTRH, Coast Provisional General Lab, and many other labs. Now, for you to go into the lab, you must put on a PPE or a lab coat that helps safeguard your clothes. So my colleague, Winnie, she's a lab scientist and epidemiologist who is responsible for actually testing in the lab. So he's going to give us some lab coats that we really need to put on before we go into the lab. The purpose of the lab coat is for safety purposes when you are working in a lab. Right. These are called disposable lab coats. Once we use it, after the initial use, you throw it away. Yeah. You cannot reuse it again. You will also be given gloves just to safeguard. You may touch something wrongly in the lab, and so she will be giving us some gloves. Then there are different sizes of gloves, so you must choose the one that fits your size. For example, mine is medium, and I could see this is medium, and I see Purity is also medium. Okay. Since we are not going to do any analysis, this is just enough. And now you are most welcome into the lab.
All right, so join us, of course, as we go through the testing process, having a look at the sample where they're going to be tested, and of course, most importantly, where data will be relayed to patients or people whose samples have been taken before or in the last 24 hours. That in exclusive interview on this government facility, the National Influenza Center, coming your way live right here at Channel 1 News. So let's get started, Doc.
Okay, you are most welcome to National Influenza Reference Lab. It's a reference lab for Republic of Kenya focused on the flu surveillance. My colleague here, Wangoi, will demonstrate how she put on her PPE before she go and analyze the sample. So kindly. So in this lab, we normally manipulate live viruses. And therefore, safety is extremely important. As a healthcare worker, if we don't demonstrate and prove our safety practice, then we may risk.
So testing can also be done in this lab?
Yes, the testing is done in this lab, right? So now she's done and she's ready to receive a specimen, right?
So specimen from samples taken?
Specimen from samples taken from the patients, right? So when I say the specimens, what we have here is at the hospital, specimens are collected. And then the specimens are moved from the hospital to this lab. A process we call moving the specimens, not patient. So patients don't move, but the specimen is moved to the reference lab. So once we receive the specimens, then that is where we start from. This is called Biosafety Cabinet. This cabinet will save, maybe you can focus on that, will save the officer or the healthcare worker who is analyzing the specimen, right? Like I rightly said, this is manipulating live virus. It is not in your body now. It is live, very, very infective, very, very infectious. And it must be handled under Biosafety Cabinet anytime. Now, the Biosafety Cabinet safeguards the officer. The specimens has areas. So that areas, when you open it up, it pops up. It will not come back to the officer. It will be handled by the safety cabinet because of the airflow. And we have filters that safeguard the environment. So, and any lab that handles this type of organism must work under such Biosafety Cabinet. Let's now focus on the process.
Probably the government has been testing different samples every day, and we get daily updates on the last 24 hours. 900 samples were taken, 500. Let's talk about the importance of testing for COVID-19 as far as controlling spread of corona is concerned, not just in the country but also globally.
The importance of testing, one, when we talk of coronavirus, it's a viral disease. You cannot clinically know if the patient is infected or not. Two, we do not have known drugs to treat this coronavirus, right? There are no vaccines. The one important thing that will help the medical professionals to control the spread of this disease is to know the status of our patient. And therefore, testing is the most important intervention. So we normally say testing, testing, testing. We must test, we must know the status. Why? Because for us to help that patient, we must know the status of the patient, if they have the virus or not. Now, this virus, you cannot know it clinically. By looking at me, you can't know whether I have or not. I must collect a sample and test it in the lab and give it to a clinician or a physician then to take over. Yeah. And that is the importance.
So do you also test people who don't show any symptoms because they have been... Also test people who don't show any symptoms because they have been called that if, for example, you have fever or you're coughing or headache, then you need to visit the next facility for testing. Who exactly do you test?
We are all at risk because we are at what we refer to as community transmission. All of us are at risk, regardless. It doesn't select the age or the sex, we are all at risk. However, the people who fail to follow the government guidance, for example, putting on mask, right? Not keeping the distance, social distance, right? They may be at major risk, kind of. The people who are working in government hospital facilities, right? They are at risk, right? The people who are immunosuppressed, right? With their comorbidities, but at the same time, they are not following the government guidance. They are also at risk, right? So generally speaking, there are different levels of risk, But all of us are at risk.
How are you getting these samples? Are they people who have shown symptoms, or how exactly? I know plus the contacts of the people who are positive, but how are you getting or narrowing down to people who you may suspect to be positive and therefore testing them on a daily basis?
Quite a number of them are from hospitals, right? Or from quarantine sites. When the government announced that anybody who travels in will be quarantined for 14 days, the law detects that after 10 days, we must test them, right? So some of them are coming from the quarantine, right? Others are coming from the hospitals where they have symptoms and they visited our facilities, right? While others are contact people who we feel may have contacted the positive individuals.
There's a fear that is really affecting people. One, you don't want to be quarantined. Number two, because this disease does not have any cure, so you think you're going to die. Are these true, or they're just myths about COVID-19?
If you look at the current data we have as a country, we've lost mainly 14 individuals, which is a number, really. But they do have underlying conditions, right? So out of 300 positives, we've already released over 90 who have gone home now. That means our health system is working. The importance of testing, like I rightly said, is to know your status and then manage and to save your loved ones, because you are infected, you don't know. You transmit to your colleagues, to your loved one. So it is important to be tested. Link that to quarantine. Quarantine is not a prison. Quarantine is a facility meant to help prevent the transmission, right? And it is well managed. However, there is fear in the public that I am positive, my family will be quarantined. No, that is not the case. The case is to safeguard your loved ones, right? Because you are infected. Sometimes you could be infected, but your neighbor, your girl, your boy, your husband, or your wife may not be infected. But putting you into isolation hospital, right, safeguards your loved ones. That is the basic of the quarantine or the isolation. It is not meant to punish anybody. No. The question of punishment should not arise.
Okay. Let's talk about the cost of this test for COVID-19, and at whose cost are you doing this?
The Kenya government have procured the equipment that I'm going to show you guys and the kits. So we offer it for free. We don't charge. However, if you have resources and you go to private hospitals, they do charge. But there's 14 facilities, 14 different laboratories in Kenya where government has put in place, they're offering these services for free. You're not supposed to be charged.
Okay.
And two, you don't need to move from your facility to come to the lab. No. The government has put in place a program called Moving the Specimen, Not Patient. So if you're in Mandera, you don't need to move from Mandera. We collect the specimen, move the specimen ourselves to the reference lab where testing takes place, and then take back result to where you are.
Quickly, before the samples are taken, take us through the process.
Thank you.
What testing involves, basically?
Testing involves first one-to-one discussion with our client. You know what we call counseling, pre-counseling or pre-testing counseling. This is bringing the patient to the spirit, telling them what we're going to take you through, the importance of that test. And then if there's any discomfort, how much is it? What implication does it have on you? Then after that, we collect the specimens, right? So the specimen is collected and sent to the reference lab where the testing will take place. So with the result, whether it is negative or positive, the clinician now invite the patient and they take them through what we call post-counseling, test counseling. So you are taken through. If, for example, your result is positive, they'll tell you your result is positive, you have this COVID, but all is not lost. We will help you, we will manage you, we will treat you, and you will be fine. And then they'll share with you where they will isolate you, right? Depending, again, with the levels of the infections. Then after that, you are managed. If your results are negative, you will also be cancelled. You'll be told it is negative today, but it doesn't mean that it will be negative throughout. You can turn positive after a week because of the exposure. So you are told, maintain social distancing, always put on your mask, keep high levels of hygiene. You know all those processes you are taken through. And you are told, go home safely.
So Dr. Momo will be taking my samples in a few moments to just practically show you what testing for COVID-19 really involves. And we are here at the National Influenza Center where the samples will be taken, and probably under 24 hours I will be able to know my results.
We'll be doing a COVID-19 testing for you. It's a simple test. There will be slight discomfort. We'll collect specimen from your nose and from your throat. It's like 2 minutes. What normally happens is a slight discomfort. Have you traveled any healthcare facilities within the last 14 days? No. You've not been to Nairobi Hospital, you've not been to Aga Khan, you've not been to Kenyatta? No. Okay. Have you had a close contact with any non-COVID positive person?
No.
Okay. No. Not that you know. Okay. What about, have you been to contact with anybody with the respiratory diseases like cough or flu? No. Okay. Now, we will be collecting your specimen, right? So my colleague will collect the specimens. So it's just 2 minutes. There will be, he first makes sure the patient is comfortable. Then now he's inserting the nasopharyngeal swabs and collecting it gently, right? It's like some seconds. So he's already out. That's it. So he's putting now the specimen into what we call viral transport media. And that is now, she has removed some tearing, and that is the best practice.
It's not painful, but it's
really not painful, yeah, but just some slight discomfort. I'm sure that the specimen has now been collected well. It's an indicator that he did an excellent job.
It's not painful,
it's really not painful, yeah, but just some slight discomfort. So, like I said, the indicator for good specimen collection from the nasopharyngeal is that tearing, kind of. I'm going to oral now.
Remove your tongue out.
Yeah, she'll be told to remove her tongue out, and then he septically goes behind and then collect the specimens.
Remove the tongue, remove the tongue.
Good. That is done. We are now done with the specimen collections. Thank you so much, Purity. I hope it's not very, very uncomfortable.
For the tongue,
Yeah.
actually there's nothing.
Yes.
But for the nose,
Yes, some slight discomfort.
yeah.
Okay. So now we've collected your specimen, and we will be taking it to the lab. I want to share with you, to show you how they disinfect himself, his hands now. And then he's already packed his specimen. The specimen is now taken to the lab, and the testing will start. Okay? So we will call out when the results are out, or get your email, or we'll send to your doctor, right? And then the result will be shared with you.
Okay.
Yes.
Thank you so much, Doc.
So this is the Purity specimen that we collected at the facility site. And now our colleague, Dr. Jan, has just brought it in. The colleague, responsible officer at the lab, will receive and ensure that all the data are entered, right? And now the specimen has arrived in the lab.
That was it, Dr. Mamo and the team. They have been able to take my sample. The experience, I would say, it was not painful, But for the nose test, it was a bit uncomfortable. And as you saw, I was teary for the samples that were being taken through my mouth. It was absolutely not painful. I even thought it was going to get painful, but then the doctor told me we were done. So from here, my sample, of course, will be taken to the lab for testing, after which probably in the next 24 hours, when the results will be relayed to the national government, then I'll be able to know my results. So from here, we will be heading to the data room, where now data of the samples collected and tested is usually relayed to the national government.
Thank you. Thank you.
So this is the COVID-19 data lab center, where the samples taken from across the country, of course, tested. The results are relayed here through this center to the national government. What you get daily from the government through the Ministry of Health on the daily COVID-19 update. We are still with Dr. Mamo, who will be telling us how they compile these results, and now at what level do they relay them to the national government for announcement. Once again, we are with you, Dr. Mamo. So thank you. Tell us what happens here. Of course, I know it's about now the results being officially taken to the government for announcement, or for people to be aware on where we are as a country regarding the numbers of COVID-19, yeah?
What you see here is the aggregated data that we analyze daily. We have like 14 to 16 labs, actually. 14 government labs now, and 3 private labs that are testing for COVID. Normally, after every 24 hours, they submit their data to this center. Then the center compile, analyze the data, and hand over to the ministry leadership, that then look at it, give guidance, and they share with the country. And it's a process normally. Yeah. So it's a long process. When you are tested, we collect a lot of information. Then the information are submitted to us with the lab results. Yeah. Now, then at that point, the epidemiologists look at what we call the epi information, the data that you really need to know for us to manage the outbreak or the pandemic.
So the accuracy of this data or tests results, before you can say that it's now official, these are the number of people across the country that are positive. Let's talk about how long does it take, probably from the lab where the samples are taken to where now the testing is being done, and finally the results being brought here, and you taking to the government officially. Okay. Yeah.
The center is under the Ministry of Health. So all the testing lab, once they receive the specimen from the patient or from the facilities, are given like 24 hours to analyze that specimen and submit the data here. The submission is done through an online systems, which is controlled by the center. So then at this, they will analyze the data, looking at the quality of the data submitted, both demographic and clinical information and the lab informations. Then they analyzed and make sense out of it, because what they submit is raw data. But there are certain indicators that on daily basis we report. For example, if you see here, it tells us out of all the samples we've tested, like 17,000 samples, 98% are negative. So we only have 1.9% which are positive. That is an aggregated kind of. And then we will also look at the month. For example, yesterday you had announced 25th April, we are now 7, but we analyzed 754 samples, of which 7 turned positives. So, but these guys, we look at those positive, 7 positive. Where are these individuals coming from? Which hospital are they in? Which county are they in? Sub-counties, all those informations are looked into at this center. On the left side, this is the map of the country. So we also look at the country. When we're talking of testing, where are these specimens coming from? So from the map, you realize the specimens are coming from all the corners of the country. And you also realize that currently, The testing takes place at a central place, mainly in Nairobi, at Coast, and Western Kenya.
So there is a plan for the government to roll out a mass testing in the country, and this is where it will be able to really know and understand how many people are positive. For now, the country is undertaking target testing. So the Minister of Health says it's ready and it's all system go as far as mass testing is concerned. And therefore, next, we are taking you to where the mass testing exercise, or let's say test for COVID-19, will be taking place still under the Minister of Health. This is the center that the government, through the Ministry of Health, hopes to use for the mass testing that is expected to be rolled out. And Dr. Nancy Bowen will be helping us really understand the capacity for this country to do the mass testing and how many samples are we talking about, because we've been seeing with other tests, the government or the ministry being able to test at least about 900 samples or so. So here we want to just know, when we talk about mass testing, how many samples at a go. Thank you so much, Nancy, for your time. Probably tell us, when we talk about mass testing and when the ministry says that it's ready to start this mass testing exercise, what sort of preparedness are we seeing, or are we talking about from your end?
Thank you so much. When we talk about mass testing, we have high throughput equipments within our testing lab, which we have about 5 of big equipments called C8800, the Cobra C8800, 5 within 5 labs, and we have C6800 in, again, another 5 labs. And the C8800 can be able to do about 2,000 samples in 24 hours. So in a 8 hours run, we can do about 1,000 samples. So when, yes, but 24 hours, which is a 1 day, is 2,000. Yes, because it's a automated equipment, fully automated equipment. We don't manipulate so many things. We only transfer our samples as we receive. As we transfer to the tubes we use, the equipment does the test. And within 3.5 hours, the first runs or results will be read within the earth. And it continuously, in 30 minutes, it continues reading like that. Yeah. So that's why we are saying we are able to give you results of 2,000 samples in 1 day. But here they make sure that everything is in place. The pipettes, the reagents, what you'll be able to run, they look at it and they tell you it's okay. On this place, again, it's the same. There are 2 processing where they analyze. So from here, they can now extract the RNA, because it's a PCR, it's a molecular testing. So they extract the nucleic acid, and then if it's from the sample, and then they do the PCR. The PCR means they multiply from a small unit up to the place where you can detect from the machine. So we have 4 cyclers here where they do those amplification, and it's called a RT, or reverse transcriptase PCR, because the moment they do the PCR, you can also read or detect if the thing is positive or negative. Yeah. So the first run will be 3.5 hours, and that first run will be able to give a result of 94 samples. So, and I said, because you are loading as you start, so the first run will read 3.5 hours, and it continuously now read the others. Okay. Yes. So it continues, yes. And it will not take 3.5 hours for the second. After the first one, after the 3.5 hours for the first, the others will continuously be reading. Maybe in 30 minutes, you see another 100. 30 minutes, 100. Okay. So within 8 hours, 1,000 samples will be read. Mm-hmm. Yes.
Dr. Nancy Bowen, thank you so much for your time. And of course, that has been intense, well explained. on the testing for COVID-19, from sample collection, testing, where data is relayed to the national government, and now this new agenda by the government to start the mass testing exercise. I hope it has been helpful. Actually, the testing process is not as complicated as every person thinks out there. It's been great having your company. My name is Purity Museu. God bless.